Party is calling for exclusion zones to be put up around schools to prevent protesters from intimidating and harassing students. I didn't realise it was this big a problem, actually, I have to say.
We'll find out how big it is in a second. It's the latest demand from the opposition party. They want to see tougher COVID restrictions, despite some modelling that's been published this morning suggesting that cases are about to peak and then fall steeply as we move into November, even without a Plan B being enacted. Well, joining us now is the leader of the Labour Party, Sir Keir Starmer. Good morning, Sir Keir.
Morning.
Thank you very much for being here, suited and booted and jacket and shirt and tie, which to some extent surprised me a little because from where I'm sitting, it seems to me the Conservatives have stolen your party's clothes. You just look at all the things they're doing. Massive spending on the NHS, tax rises, national insurance going up shortly, pledges to spend shed loads more in the public sector. I mean, it must be a bit frustrating for you because that's sort of Labour's stance, isn't it?
I don't think taxing working families, which is where they put most of their taxes, can be said to be stealing our clothes. We say that taxes should be with those with the broadest shoulders and not, though, working families. So they're not stealing our clothes by taxing working people, quite the opposite.
Do you feel, to some extent, the Tories have moved into your territory? They've moved into the centre ground?
No, I think that they've... they've raised taxes hugely. I think we've got the highest taxation now since the war.
But raising tax for social care, though, social care tax.
Well, that's what they say.
Yeah?
But, I mean, that money is going to go to the NHS and then, theoretically, it comes back to social care in a number of years' time. It doesn't actually improve social care one bit. It doesn't say anything about the staff in social care. You know, the question that I think most people ask is, well, where are you focusing this? Are you going to focus it on those with the broadest shoulder? Are you going to focus it on working people? And they're absolutely hammering working people. And it comes at the same time that they're doing two other things. Firstly, universal credit is being cut for 6 million families. These are families that need that money to make ends meet. And, of course, what we're seeing is prices going up, energy prices going up. So working people are getting hammered from both
there is an increase
ends.
in the national living wage on its way, isn't there?
Well, let's wait and see. There's a lot coming on Wednesday that's speculation.
I mean, there's a lot of spending going on, and I think there's sort of one of the headlines this morning is about 6 billion extra to try and clear that backlog of elective surgery and all the cataracts and all the hip operations, everything that's been stalled. 5.7 million people waiting for treatment. Frustratingly, everyone understands why. But this is a key moment, isn't it, for the Tory party? They have to deliver on that, and they are putting their money where their mouth is now.
Well, let's wait and see what the small print is, because I've seen this many times where money that's already been allocated is re-announced. But let's see. Money for the NHS is always welcome. But let's see what the small print is on Wednesday. The other thing about the NHS that's really important is that it's staff, really, that we need as much as equipment and scanning equipment, which is always welcome. It's the staff that we haven't got to operate the equipment at the moment. That's a bigger problem in the NHS. But as I say, there are lots and lots of announcements in the hours going up to Wednesday's budget. Let's see what it actually is when it arrives.
So the thrust behind that opening question really was, is there still a role for Labour in the current political climate? Do you still have a comfortable position that you can operate from? And you seem to be saying you do. But we go back to what for you was personally a very happy party conference. There doesn't seem to be any big message coming from you as leader and from your party. I'm not quite sure what... I can see Labour's criticisms of the Tories, and you've just gone through them here. But what's your big idea?
Well, I think getting rid of business rates is something the business community has been asking for years to boost our economy. Cutting VAT on fuel so that working families through this winter can actually afford to pay their bills, and then a huge investment in the jobs that we need for the future. We've pledged £28 billion a year for this decade to tackle the climate crisis, as well as investing in the jobs for the future. That is a huge economic investment, and what we're saying on the economy now is far more credible than what the Conservatives are saying. They're taxing high, but delivering low, and that is not a combination that's going to help our economy or working people.
Just moving to the politics of the personal, is it true, as it was reported in several Sunday newspapers yesterday, from well-placed sources, that you are now sidelining Angela Rayner, your deputy, because of her comments about Tory scum, that you found those embarrassing, and obviously in the light of the terrible events that happened 2 Fridays ago, incredibly poorly timed, and that you're actually keeping her out of sight? and bringing other people
No,
forward. Is that true?
That's not true. Every Sunday I get all of the newspapers and I faithfully go through them and read lots of things that are apparently happening that bear no relation to the truth.
So she's still your best girl, is she?
Well, look, what I would say, in all seriousness, is that Angela Rayner's had a bereavement of a very, very close person to her, someone that she treated more or less as her mother. And so she's had a very bad and hard week last week, and she's got a funeral coming up in relation to that. So her absence is actually to do with that bereavement rather than anything else. But as I say, I enjoy reading the papers and hearing all sorts of stories that bear no relation to the truth.
And given all the big news around this week, there's the budget, there is, of course, this new modelling that we're talking about that suggests that COVID cases may slump. You've still backed that we should be going hard and fast into Plan B now rather than waiting. And you still stand by that, do you? Plan B meaning mandating mask wearing, working from home as far as possible?
Yeah, I mean, we actually, if you go back to July, when Freedom Day was announced, we said don't do it all at once, keep masks and keep the flexibility of working from home. They're small measures, and particularly masks. I mean, you know, on one level, of course, nobody wants to wear a mask, but it's a small measure that protects yourself and everybody else. It's not much to ask, and so those restrictions should be in place. My only frustration in the last few days, I suppose, there's been a lot of attention on Plan B, which does include those restrictions. They make sense. But I think the real problem is that the vaccine booster programme has slowed down so much that we're not going to get through the boosters until the spring of next year. I think I'm right in saying only 17% of children have been vaccinated. Spain, I think, is up to about 80%.
Why do you think we've lost focus on the booster campaign as opposed to the first two jabs, which I'm sure you'd agree went very, very well?
They did go well.
But it seems to be falling apart. What's your analysis of that?
I think that what we need to do is to reinstate pop-up centres where people can easily go and have their vaccine. Community chemists are very keen, pharmacists are very keen to do more work. I was in one of them last week in London and they said they could do more, but they're not getting people through the door, so they're willing to do it. And we've dropped off with the retired health workers who were brought back in the early part of the year to help with the programme.
Do you think that's because Boris Johnson has taken his eye off the ball? He's talking constantly about the climate conference, which is up and coming, that actually that's become his focus?
I think he has taken his eye off the ball and, you know, this was supposed to be the security wall against the virus, and the wall is now crumbling. And therefore, masks, working from home, I'm in favour of that. That seems to me to be common sense. But actually, the real focus has to be on how do we get the vaccine rollout back up to, I think, 500,000 a week, so we can get
That's come
through
from
the
Tony Blair, hasn't it? That's not your idea, is it?
Well, I mean, I said it the other day, he said it the other day. I don't really care where the ideas come from. If that's about the right number that we need to get back to, that's what we should be doing.
Okay. It does sort of hark back a little bit to what Richard was saying, in the sense that Tony Blair seems to have a very loud voice still for the Labour Party. And, of course, you know, he talks, he's got his foundation, they do lots of research. Not just other Tories, potentially, you know, as one might argue, in terms of its spending, furlough, all of that, taking Labour's lead. They're, you know, putting money into rail schemes in the north and in the Midlands where they have the Red Wall. You know, and now and Tony Blair says let's have 500,000 booster vaccines a day, and now you come on TV and say the same thing. The question is, I suppose, for many people, what does Keir Starmer really?
Can I just pick you up? I
sure
have
thing.
to on the because the Northern Powerhouse Rail has been. That was announced by the Tories 7 years ago. It has been re-announced 60 times, I kid you not, since then, and there still isn't a spade in the ground in relation to it. So far from stealing our clothes, what they're doing is taxing high and delivering low, I'm afraid.
The interesting thing is, of course, that this morning, you know, we started our introduction to you by talking about some exclusion zones that you want around schools. How big a problem is that? And some might say it sounds quite small fry, given some of the really big issues that we've been talking about.
Well, there's growing evidence of the anti-vax protesters outside schools, intimidating children and parents, actually covertly filming them in many respects. So this is a real and growing problem. If you speak to parents and teachers, they know that this is a real problem and it's growing. And at the moment, what do we need? We need our children to be vaccinated. We're behind, as I say, I think only 17% have been vaccinated. The last thing we need is this misinformation on the doorstep of the school. These are 12 to 15-year-old children going into school.
So how do you stop it?
Well, you can have exclusion zones now used for other purposes. What we're saying is fast-track that procedure. You could have an exclusion zone in place, move the protesters away from the school, remove the problem and deal with it very, very swiftly.
One of those protesters is Jeremy Corbyn's brother, isn't it? Piers Corbyn. I saw him at Labour Party conference, and he is included. Is it embarrassing for Labour that
he wasn't at Labour Party conference?
No, he was there. He was
Labour
there.
Party.
Yes, exactly. Yes, exactly. I saw
the person he was trying to harass was me as I was leaving.
Indeed.
So I'd have been very happy for an exclusion zone. But in all seriousness, look, you're talking about 12 to 15-year-old children going into school, being harassed at the school gates by anti-vaxxers with misinformation, covert filming, harassment of them and their parents, when what we want is those children to go in to be vaccinated.
Yeah,
so
no child should be feeling threatened or upset.
No.
And I think there is some suggestion that they're showing pictures of deformed children and all of this sort of saying it's the vaccines that done it and it's wrong.
And saying you're going to be infertile, etc. This is to 12 to 15-year-old
Yes.
children
What
as
about
they go
an
in.
exclusion?
It's a simple measure.
Okay.
I mean, I saw that the Home Secretary looks as if she's supportive. Get on then, let's do it. We could probably do it this week.
What about an exclusion zone for the hard left on your party? Some of the criticism you got after conference a couple of weeks ago was that you basically didn't seize the opportunity to give them a good kicking and to make it absolutely clear that the days of the Corbynistas, as we might call them, is well and truly over.
Well, look, I had the first few days of conference, everybody saying, why on earth is he taking these rule changes to change his party? Surely this is not the time, etc. We had massive rule changes in relation to the leadership of the Labour Party, in relation to reselection of MPs and anti-Semitism, made a huge difference. And everybody that was criticising me on the way in saying, why are you doing this, recognised that we changed the party for the better on that Sunday in conference. And then I followed up with my conference speech and anybody who saw that, and I realise not everybody did, will have seen that there were a few hecklers, but actually the vast majority of people in the room, vast majority of members, actually did my job for me, which was to shut the hecklers up. And the slogan I used, the push-down I used, was to say, chanting slogans or changing lives. And that's the choice the Labour Party has to make. We can sit on the sidelines protesting, or we can be fit for government and go into government. And the second is the choice we have to make.
Before you go, can I just ask you a question just going back to COVID? Because we have Sajid Javid coming on the programme later. He seems to be very keen on forcing NHS workers who have not yet been double vaccinated to either have it or be removed from the front line and go and find other jobs, or, and it will cause, the NHS themselves are saying, look, far from solving the problem of spreading the virus, it will actually cause staff shortages. Where do you stand on mandating NHS staff to have the vaccine?
Yeah. First thing I should say is I want all NHS staff to be double vaccinated.
You might want it, but what about forcing them?
I think forcing them is a mistake. It's better to encourage and cajole. In Wales, they've encouraged and cajoled in relation to the care sector and done it very, very successfully.
Yes, there's an 11th of November deadline here for care work staff. That's going to cause a problem for care.
The problem I fear we're going to get is that you're going to have thousands of NHS staff who can't work any longer, just when we've got massive vacancies in the NHS as it is. And if I was to ask myself, is the problem in our hospitals in terms of the virus, or is the problem in our schools where we aren't getting through the vaccination programme quickly enough? I'd say it's the second of those.
So you think it's worth a gamble? I mean, if it was you wouldn't be mandating that 7% of NHS workers, over 100,000 of them, I think, to have it. They could still work with vulnerable patients without having the vaccine, even though some of the researchers, Dr. Amir was saying, it reduces transmission by 65%, certainly the Pfizer one. That's some of the evidence.
I'd encourage them to have it. And look, my wife works in the NHS, so I know what it's like on a daily basis. They have been doing... obviously encouraging vaccinations, but also you've got to have a negative test, I think, 3 times a week, every week.
And you think that's enough without being forced to be double vaccinated?
I've forgotten exactly how long my wife's been doing this. They've been operating that system, I'd say, for probably all of this year, if not 12 months.
And you think that's enough?
Successful.
You think that's
enough? So we have a mini sort of test centre at home. My wife does it 3 times a week. My boy has to do it to go to school twice a week. That has been in operation, and therefore mandating it when... Actually, if I was the Health Secretary, I'd say, what are you going to do to get our children vaccinated more quickly? What are you going to do to roll out the booster more quickly? Because I think that is the security wall that needs to be rebuilt. The government's let it crumble.
Well, that's certainly the view of our viewers who are trying desperately to get their boosters and are being told that they're not eligible when they patently are. There is clearly an issue with the system that needs fixing. We'll be putting that to the Health Secretary very, very shortly. Thank you very much indeed for coming in.
Keir
Nice to
Starmer,
see you.
thank you so
Nice to see you.
much.